The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. My guest today on Meet the Doctor is Jeff Lisiecki. He's a plastic surgeon in New York City. Are you working in New York City proper? Are you outside the city? Where are you?
Yes, in the city. My office is at 71st and Park, so smack in the middle of the Upper East Side.
Neighborhood.
I know, really rough neighborhood. No other plastic surgeons around, just kind of the Wild West.
Yeah, blue ocean right there. That's exciting. And I'm looking at you, and I am sure that you're definitely not decades into practice.
No.
So you're just getting started?
Mm-hmm. Yep.
And I would love to hear how you got here to the Upper East Side. Like, give us the short version of your life story.
Yeah, absolutely. Well, I'm from Michigan. I went to college out east at Brown and then went back to Michigan for med school and residency. And then I did a fellowship down in Dallas, Texas under Rohrich, who's a very famous facelift and rhinoplasty surgeon. And then after that, I moved up here and opened my office on the Upper East Side. So it was about 10 months ago that we opened the doors, and it's been going amazingly.
Why New York?
A bunch of things. I mean, is there a better place to be a facelift and rhinoplasty surgeon than New York City?
Probably not.
But also my wife's work is based in New York. And so we always kind of knew that we were going to move back here for her work. And I have family here as well. So it's just kind of, we have a bunch of friends who live here, just kind of where we always knew we were going to end up.
And these are big decisions because when you go into practice and you're basically deciding we're going to live here for the rest of our lives.
Pretty much.
Unless something strange happens. And I just spoke to somebody who packed up after 15 years in Chicago and moved the whole practice. And it was a great move. So it's done, but not very often.
Mm-hmm. Yeah, it's a lot of work starting a practice and, being about a year into it now, it's not something I'm itching to do again. There's just a lot of logistics and finding the right staff and, just getting everything set up and then just building that momentum of people knowing about you and coming in and all that. So I could imagine it's a very difficult thing to do once you're already set up in one place.
It's also really exciting.
Yes, very much.
And the stage you're in is really exciting. I love building stuff. And I think there's no better place to be than like trying to grow something.
Mm-hmm. Yeah, definitely.
Although a lot of us, I think surgeons and musicians, which is where I started, are sort of raised to think there is no there. Like you're always moving towards something in the future.
Mm-hmm.
You never made it.
Mm-hmm.
You will never make it there.
I think that's very true. And I don't think that's a bad thing necessarily.
No, I don't either.
If you think you've gotten there, then you have no incentive to get any better or do anything differently. And that's how people stagnate and do the same thing for 30 years and never grow, never improve. So, yeah.
People like that mystify me.
Mm-hmm. Yeah. I don't know how people function like that. And I hope to never do that.
I think you're on the right track.
Yeah.
So you specialize in face procedures, and there are two paths to doing face procedures, really. I mean, there's probably more than two, but there's two main ones. And yours was through plastic surgery. So can you talk a little bit about that training and how it maybe differs from what a facial plastic surgeon would go through to get there?
Mm-hmm. Yeah, definitely. So I specialize in all of aesthetic plastic surgery with definitely a lean towards face and nose, but I do breast and body surgery as well. A lot of breast surgery particularly. The path to becoming an aesthetic plastic surgeon is 6 years of plastic surgery residency. So out of medical school, you match into plastic surgery residency and do that. There is an alternative route. It used to be more common in the past. It is still available. Some people do general surgery, which is 5 to 7 years of general surgery, and then 3 years of plastic surgery. That's becoming a little less popular. So I did the 6 years of plastic surgery training, and that's everything reconstructive and cosmetic, face, nose, breast, body, craniofacial, hand, microsurgery, everything. It is a huge amount of surgery in 6 years. And then after that, I did a fellowship. There are fellowships in aesthetic plastic surgery that are offered through the Aesthetic Society, which is sort of the premier aesthetic surgery association. So there are Aesthetic Society endorsed fellowships where there's a very defined curriculum of what you have to cover. Mine had an independent practice clinic as well. So I was seeing my own patients, operating on my own patients, and then also operating on patients with the faculty at my fellowship. And, my main mentor in fellowship and still is Dr. Rohrich, who's an incredible facelift and rhinoplasty surgeon. And so most of my time in
researcher, publisher,
and was the chair of our journal for many years, or was the editor of our journal for many years, and was the chair of UT Southwestern Plastic Surgery for many years. Just a powerhouse. So spent a lot of time with him doing facelift and rhinoplasty, writing about it, coming back. And
yeah, you're answering my questions before I can ask them.
Yeah.
Did you write a lot of papers while you were there with him?
Yeah, I wrote a good handful of papers while I was there with him. I've written a couple of textbook chapters as well, contributing hopefully to the next edition of his big rhinoplasty textbook. And yeah, so a bunch of writing, a bunch of teaching. He teaches courses in facial anatomy, injectables, rhinoplasty, facelift, a lot of anatomy courses for other surgeons and injectors, including his own, the Dallas Rhinoplasty meeting, where I was laboratory faculty this past year and the year before that. So yeah, it's an incredible opportunity for just learning and also getting to pass on the knowledge that comes out of the huge body of work that him and that group and the whole Dallas Rhinoplasty Consortium represents, which is a very cool thing to be a part of.
So I'm going to be a huge nerd and say I have a favorite paper of Dr. Rohrich's.
Mm-hmm.
Do you have a favorite paper that you worked on or that he wrote? Is there anything that comes to mind?
A favorite paper that he wrote, I would probably say the one where he describes the anatomy of the facial fat compartments. I mean, there are so many, but that one is really kind of a landmark paper for our understanding collectively of how the anatomy of facial fat, that we don't just have blobs of fat underneath our skin until you run into the bone. There's actually a very defined system of ligamentous structures of fat compartments, and that specific fat compartments there are what we target when we're repairing facial aging, because they're the things that lose volume with age. So I think that paper has revolutionized the way that we think about facelifting and fat transfer with facelift. And it sort of, basically was a paradigm shift. I mean, facelifting didn't include fat grafting in the 90s and the 2000s. And, it's really been of the past decade or so that's become such an essential part of facelift surgery. So I think that's really been a huge landmark.
If you're a patient, you're just a regular person thinking about doing something, either non-surgical or surgical, why is it important that doctors continue to do this kind of research? And I don't want to put words in your mouth, but why is it so important that you continue to push the specialty forward?
Mm-hmm. Well, it's exactly what we were talking about before about you never arrive. And I think when you think you've arrived, you become complacent, you stop changing what you do, and then you just never get any better than that. And I'm sure there were people in the 1970s who thought that, the best facelift that could ever happen was happening then. I'm sure there were people in the 90s who thought, this is the pinnacle of facelifts. And yet, we're still evolving past that and, realizing the shortcomings of older techniques, realizing there are better, safer, more effective ways to do things. And what was done in the past is very helpful for educating us, but then also understanding, its shortcomings. And it's interesting looking back at papers from the past amazing sort of surgeons that paved the way for what we do now, but comparing results from, the greatest of the 80s and 90s to the greatest now, we're just better in general now than we were then. And it's because we all build off of the work of prior surgeons.
So my favorite Rohrich paper was one that I stumbled on about why is it so difficult for the public, for people and patients in general to understand doctor credentials.
Mm-hmm.
And I pulled him onto a webinar and interviewed him and the two fellows that wrote the paper with him about that. And in my mind, as a marketer and a person who tries to help people make good decisions, that was pivotal. because they scientifically approached why it's so difficult. And what I thought would happen from that paper was that we would stop saying, when you look for a surgeon, make sure you just find a board-certified plastic surgeon. Because this is always the standard answer, and I find that very frustrating because people, and Dr. Rohrich agreed with me, people don't understand what that means, and they don't have the knowledge to assess quality among surgeons, between each other. But what I do now is I just ask people, other than saying I'm a board-certified plastic surgeon and I'm board-certified in plastic surgery, how do you advise them to find a good doctor? What should they look at after they confirm they're a board-certified plastic surgeon?
Yeah. And I would first start off by saying, amending that to board eligible or board certified. So I'm what's called a board eligible plastic surgeon right now, just to clarify, which is the step before board certification. I've passed one of the two tests. I did a fellowship, which delays the second test effectively. So definitely look for a board eligible or board certified plastic surgeon, which means someone who has completed 6 years of plastic surgery residency in most cases. And the other thing I would definitely say to look for if you're looking for someone for your aesthetic operation is, a great place to look is at surgeons that have had one of these Aesthetic Society endorsed fellowships. So the Aesthetic Society has put a huge amount of work into creating a curriculum. These fellowships are taught by some of the foremost experts in all of aesthetic surgery. And it really is this specialization. Just like, if you were looking for a hand surgeon, you would go to someone who did a fellowship in hand surgery. If you were looking for, microvascular breast reconstruction, a deep flap, you would go to someone who did a fellowship in microsurgery. If you're looking for someone for a rhinoplasty or a breast augmentation, you should look for someone who has had subspecialty training from experts in the newest, latest, most advanced forms of aesthetic surgery, which is what these fellowships are designed to do.
In my dictionary, there's going to be this video clip under the question, what does fellowship trained mean? Because you just nailed it. It was the best explanation I've ever heard.
Oh, thank you.
Well, very practical.
Yeah.
I can see that you're a practical person.
I hope so. I try to be.
So you've been in private practice for a little while now, but you are certainly not new to seeing patients. You have been training for a very long time in the best places in this country. What can your patients expect when they come to see you for the first time?
So the first thing is I hope my patients feel at ease. And I've designed everything that I can that patients feel comfortable and relaxed from the second they walk into my office. So my staff is all incredibly professional. They all have a huge amount of experience working in the medical field, whether it's plastic surgery or dermatology or med spas. Everyone is a professional at what they do and is extremely welcoming and considerate and compassionate towards their patients. And patients come in, they let us know what they're there for. And then basically it's just, a very open conversation. I want people to communicate very candidly about what their concerns are, what bothers them. And that conversation and the in-person physical examination are kind of the keystones to diagnosing and making the plan. I hope that everyone is very open about what is bothering them, what they're looking for, what their expectations are. And that really helps me understand the patient's goals, along with understanding their lifestyle and their values and what's important to them. And then, after we have a conversation and really decide what bothers you and what we can do to make it better, then I examine you. And there's no substitute for physical examination in aesthetic surgery. I do some virtual consultations also, but they're always followed up by an in-person evaluation because, looking and feeling the tissues, understanding what's going on, particularly with faces and noses and eyelids, is extremely important. And there's going to be an examination of the aesthetics, the appearance of what's going on, but also the function. So in eyelids, making sure that people don't have functional issues regarding their eyelids or laxity. With the nose, actually examining intranasally and making sure, that I understand what's going on with the septum and turbinates. And then, after we have all that information, we have, a conversation, develop a very comprehensive plan that's going to take you all the way through from the consultation to long after your surgery. So we'll come up with an operative plan. We'll come up with everything that needs to happen preoperatively, including things like medical grade skincare, preparing skin for facial surgeries like rhinoplasty and facelift can be a very important part of the overall plan. The actual surgery, the details of what that's going to mean, and then the recovery. And surgery is not a one and done episode in any instance, but particularly in aesthetic surgery. And the post-care and the discussion of what to expect in the days, weeks, months, years after surgery is also a really, really important part of all of this. And I try to, make sure that people leave their consultation with as much understanding of, what all that is going to be.
With face and nose surgery in particular, people sometimes have a hard time visualizing how they're going to look later. And they also will use words like natural, which doesn't have a standard definition, it turns out. And I'm curious if you use any tools or technology to help people visualize what they might look like to also help you communicate with them.
Absolutely. Rhinoplasty is where this is especially essential. And I use photo manipulation. So I take standardized clinical photographs of everyone before and after surgery. These are not just iPhone photos. These are not selfies. These are scale images taken with the same lens, the same lighting for every patient before and after surgery, solid background. They're as standardized as a way of looking at you as possible. And then I do manipulations on those photographs to show what changes in your nose I think are possible and reasonable and would achieve your goals. And then I send those to patients after a rhinoplasty consultation. And it's a great tool because it lets people really get an idea of what that new nose will look like on their face in terms of proportion, shape. There's definitely some room for discussion in terms of how upturned of a tip do you like? Do you like a really straight dorsum, or do you like what we call a super tip break, a little bit more of a scooped out kind of dorsum? And this really gives an opportunity to talk about those things. And you're right, natural is such a hard word to use. I'd like to think everything I do looks natural, but there are variations on natural. Some people naturally have a super tip break in their nose. Some people naturally have a straight dorsum. It really is the best tool for communicating. Similarly, for face, it's a little bit harder. Photographic manipulations, I think, carry over a little bit less for facelifts than they do for rhinoplasties, just because it's not this defined thing sticking out of your face that we're doing the manipulations on. They can be helpful, but mostly for facelift, what I think is helpful is pointing out in person on people, showing this is the skin that's going to go away. You can kind of pull up on their cheeks and show them, this is what you could expect your jawline to look like. Here are the areas where I'm going to add fat grafting to your face to bring the light reflex up higher on your cheek and give you nice cheekbones. And I think the in-person is more helpful, honestly, for facelifts. But yeah, showing people on photographs is a very helpful way to help them anticipate what to expect.
Someone recently pointed out to me that some people have the same nose as other people in their family, and it's part of their identity, and that they may either want to retain that or completely get rid of it, depending on how they feel about their family. And the same with their chin. And I thought, oh yeah, I have a family chin. I look like all the other people in my family. Yeah. I would never want to get rid of that.
Yeah. And that's why this isn't for everyone. If you love your nose, of course, don't change it. I hear you loud and clear because my nose is exactly the same as my mom's nose, which is exactly the same as my grandfather's nose. And I don't want a rhinoplasty at all.
Right.
But yeah, it's so all of our facial features are an amalgamation of our family, genetic, ethnic background, and just the things that have happened to our face, in terms of facial aging, trauma. There are so many things that happen to us either before we're born or after we're born that determine what our face looks like. And choosing what parts of that you want to retain and what parts of that you want to change or try to turn back the clock on is exactly what this is all about. So I've definitely had people who didn't want to look like their family anymore, and have gotten rhinoplasties and chin augmentations and things like that.
Along with spies and people, no, that's usually a Washington, D.C. joke.
Yeah.
How many times do you get someone who came in and said, I need to look like a completely different person?
That's funny.
Do you have kids?
No, not yet.
Sometimes when you have little kids, they will, as kids are known to do, they headbutt you when you're not expecting it. And I've known a few moms who've had this happen where someone's sitting on their lap and all of a sudden, for no reason whatsoever, they will smash you in face.
Mm-hmm.
And one of my friends broke her nose this way.
Mm-hmm.
And I remember her saying she was in the ER and she had no idea who to call. And so she called her plastic surgeon
Mm-hmm.
for advice. And ever since then, I've always asked, if someone's listening and they happen to be one of your patients or they happen to know someone who got smashed in the face by their toddler, can they call you from the ER and say, my nose is in trouble?
Mm-hmm. Yeah, absolutely. I mean, so first off, all of my patients have my cell phone number. So if I've operated on you, you have my cell phone. And I encourage them to text, call if they have any concerns about anything, which I would certainly include breaking their nose in, especially because odds are I operated on their nose. So yeah, definitely. I love when my patients reach out, not because they had trauma, but I want my patients
they don't need to call in the middle of the night for that. Like a broken nose isn't going to change between 2 a.m. and 6 a.m. most of the time.
When someone breaks their nose, it needs to be seen. There are some things that can happen acutely after a broken nose that you want to take care of as quickly as possible. And so if you really broke your nose or think you broke your nose, someone should be looking at it. So,
away.
Going to an ER or, if you're one of my patients and, we can meet in my office late at night, we can also do that. But broken noses usually aren't an emergency. Sometimes they do have problems like a septal hematoma that should be drained sooner rather than later. Sometimes they can cause more severe epistaxis that needs to be stopped. So yeah, and especially if I operated on your nose already and then something broke your nose, definitely let me know as soon as possible.
Is this true for pretty much any facial trauma?
It depends a lot on what it is.
Yeah.
It's a question that comes up not infrequently because a lot of times people get a facial laceration from a dog or cat bite or scratch, or they get hit by a bike crossing the street and get knocked down. And so, it's something that always comes up. Can I come into your office and get my face sewn up? Which is very often the case. I do that as often as I'm able to, basically. Or is this something that should go to the emergency room? And if you're not sure, get to medical attention and have someone make that decision for you. If you're concerned, it's always better to err on the side of being cautious. But a lot of times, if it's just a laceration and you just need a physical exam to make sure that there's nothing else hugely going wrong, very often people just come into the office and get checked out, get sewn up. And
that's useful. Mm-hmm. Yeah. Yep. Save Dr. Lisiecki's phone number in your phone. After your 911, he's number 2. I do want to ask you about fat because over the years, fat, it's sort of started out like an experiment where can we move fat around? And you touched on this earlier. Mm-hmm. But today, it's really the standard, isn't it?
Mm-hmm.
And so in the procedures that you do, how are you using fat and where are you getting it from? How do you make sure it sticks? I just asked you 3 questions.
Yeah, absolutely. So fat transfer is a huge part of plastic surgery now in reconstruction and in aesthetic surgery. And yeah, it was something that was really not understood in the past. And it had a period of not great success because plastic surgeons as a whole didn't understand how to do it. And now I think we have a much better understanding. And so it's part of a lot of different things that we do. Fat transfer to the face, as I mentioned before, is really an essential part of facial rejuvenation. It's done in conjunction with basically every modern facelift. It's also something that is done a lot with blepharoplasty. With any other facial surgery, we have an opportunity if there are some areas where people are losing volume in their face where they want more volume, we can add on fat grafting to a bunch of different facial procedures. Filler is so popular nowadays, and filler is fine in certain circumstances, but there are some places where fat is just better and it's longer lasting and it's all your own tissue. And I understand some people are very concerned about getting the filler face, the overfilled, unnatural appearance. And I think carefully applied fat grafting can do wonders and can avoid some of those issues. So face, certainly, it's very common in breast surgery as well. I do a lot of fat transfer breast augmentations where we do liposuction and then transfer the fat to the breast to augment them, either alone or sometimes in conjunction with implants. We place implants, but to get better cleavage, more fullness in the upper part of the breast, or to just soften the edges of the implant and make it look more natural, we do a little fat transfer to kind of camouflage it and blend the implant with the rest of the person. Oh, and where does the fat come from?
Yeah, where are you taking it from?
Yes. So it comes from a variety of places. For the face, I almost always harvest fat from the inner thighs. And it's a place where everyone has a little bit of fat that they would be happy to be rid of. It doesn't hurt very much. You get a little bruising, it's a little sore, but harvesting fat from the inner thighs is usually very comfortable for patients afterwards. And there's also, talking about great Rohrich papers, there's also a great paper talking about how the stem cell populations of the fat of the inner thighs tend to be a little bit richer than the concentration of stem cells in abdominal fat for a lot of patients. And so, the creme de la creme of fat to me is fat that comes from the inner thighs, especially when I'm transferring to the face where it's just a little bit of fat and, I want the best stuff and the stuff that's going to bring the most stem cells, be the most rejuvenating to the soft tissues, all of that. For breasts and fat transfer to the butt and things like that, we need more volume than the inner thighs can supply. And then we're taking fat from abdomen, flanks, back, thighs, wherever there's fat to be taken.
Doesn't it really depend on the thighs, whether there's enough or not enough?
It does depend. If we're doing a full fat transfer breast augmentation, well, you have to be careful with the inner thigh liposuction also. If you're really aggressive, that's an area where people can get some extra loose skin or contour irregularities of the inner thighs. So you can't go crazy with liposuction on the inner thighs. But yes, everyone's individual. Can you do just thighs to the breasts or to the hips or something like that? I'm sure it's happened.
I'm sure. So we should probably make a whole podcast just of Rod Rohrich's papers where we discuss each.
We do the Dr. Rohrich Journal Club and talk about all of our favorite things.
Break them and work our way through. Yeah, that would be really fun.
Yeah.
You'd need a non-doctor on there to ask dumb questions so that everyone could benefit.
Mm-hmm. Yeah.
Yeah, that would be great.
It's funny.
So before we wrap it up, I'm very curious what you like to do away from work. You've obviously worked very, very hard to get where you are, but you can't work all the time.
Yeah. Yeah. So just spending time with friends and family, spending time with my wife, spending time with our dog. We have a bunch of friends here in the city, which is another one of the reasons we moved back. We have family in the city also. So just trying to do things with them and spend time at the park, go on hikes, go on trips around the city or outside the city. And I love to work out also. So I try to do that at least a few times a week. Those are kind of the big things, and travel whenever I'm able to.
Mm-hmm. What do you like to do at the gym?
Just lifting weights and yeah.
You're a self-directed kind of fitness person?
Yeah, definitely.
I need to go to a class.
I know so many people who are like that, who are just, I go in and then I just have no idea what to do. It's something that's been part of my life for a long time. Since I was probably 16 years old, I've sort of been going and lifting weights on my own. So it's just kind of something that I really like to do. It's very relaxing to me and just feels good. It's a good way to blow off steam and think about things and clear your head after a day.
Yeah, so true. If we're listening and interested in finding out more about you, where should we go online?
Yeah, absolutely. So drjefflisiecki.com is my website. And it's also my Instagram and TikTok handle. So anywhere where you find Dr. Jeff Lisiecki, you'll find me on Real Self. You'll find me on any of the platforms you'd expect to find a plastic surgeon, basically. Or just come on up to 71st and Park.
Just yell from the corner loud.
Yell from the corner really loud, and probably someone will hear you in the front office, and then they'll say,
"Can I help you?"
That's funny.
That's great.
Yeah.
Oh, I will put all those links in the show notes. And thank you so much for sharing your stories with us today.
Absolutely. Thank you so much for having me. This was a lot of fun.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor, or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.